Hi.
Hi.
Good morning. Multiple sclerosis is a progressive disease that can cause lesions in the central nervous system, including the spinal cord and brain, disrupting the flow of information from the brain to the body. While most people have heard of the disease, many aren't aware of the causes, symptoms, and what it's like to live with MS. To combat this lack of knowledge, Celgene has launched MS MindShift, a new view of MS which takes on a new perspective on MS. Joining us now is Dr. Barry Singer, Director of the MS Center for Innovations in Care at Missouri Baptist Medical Center, St. Louis, and Carolyn Craven, who lives with MS. Doctor, can you tell us a little bit about MS and what are the symptoms?
Yeah, so multiple sclerosis is an immune disease. So the immune system can attack the brain and spinal cord and the nerves of the eye. So what it causes is symptoms such as numbness, let's say in your legs, it comes up your torso into your hands. It might cause visual loss out of one eye, double vision, spinning sensations. 90% of people with MS have fatigue or bladder problems. So what happens is you get these immune attacks, and they can last 2-3 weeks, and then over time, or even 2 months, and then they tend to get better. But over time, people can lead to progressive physical and cognitive disability. So really the goal is to get on top of it early, make a diagnosis. So if you're having these symptoms, go see a healthcare provider because we have highly effective treatments to prevent them from happening.
Who is at risk for MS?
So the average age to get MS is 20 to 50. In general, though, there's pediatric MS, though, and I see a lot of people later in life who also get MS, even in their 50s, 60s, and rarely in the 70s. It tends to be women, so like many autoimmune diseases, 3/4, especially in certain areas of the country, it's at least about 3/4 are women. Although men with MS tend to do a little worse in terms of physical disability. Risk factors include low vitamin D, smoking before age 17, childhood obesity, and exposure to mono-infectious EBV, Epstein-Barr virus, can increase your risk, although a lot of people without MS have been exposed.
Doctor, can you tell us a little more about the new campaign being launched?
Yeah, thanks. So MS MindShift and is really about this campaign that I've joined Celgene and MSA, the Multiple Sclerosis Association, with, is really focusing on brain health. So the brain is under attack with MS, so the immune system is attacking the brain, but we can do a lot of things to improve our brain health. Living with MS. So one of the things that can be done is exercise, so focusing on yoga, tai chi, swimming, recumbent bike. Exercise helps preserve the brain health. So does a well-balanced, healthy diet. Getting more sleep can make a big difference. So if you sleep more, you're going to be thinking more clearly. Mindfulness helps. And so in terms of meditation can really help deal with stress. And then smoking, stopping smoking is really critical. And smoking can lead to more physical and cognitive disability. Many people with MS are living with short-term memory problems, multitasking problems, trouble finding words. So be able to control that is really important. So the msmindshift.com is a website that can give you a lot of information about how MS affects the brain, but also a lot of tools and resources that can tell you how to manage MS and how you can make your brain healthier, this Brain First initiative.
Thank you. Carolyn, can you tell us a little bit about your diagnosis?
Yes, I was diagnosed with MS in 2001. When it hit me really hard. I couldn't walk, I couldn't see, it took me down hard. And it took a little while to diagnose it, even with that. Different tests, it's been a while. But that was 17 years ago, and things have changed. There's a lot more out there, a lot more we know, and a lot more we can do as patients to take control of our health.
Carolyn, what would you like to say to persons newly diagnosed with MS?
I'd really like to tell them that, you know what, if you're just newly diagnosed with MS, it is going to be okay. You're going to need to make some changes. Your lifestyle's going to need to probably change a little bit. There's going to be some more awareness. A lot of these tips are what are gathered at msmindshift.com. I wish I had had that website 20 years ago. The information they have on it is very clear about understanding what's going on in the brain. But I really want to tell everybody that it is going to be okay. Just know that, and know that you're going to need to make some changes. Stay positive. Attitude is everything, and you've got this.
I'd like to thank you both for taking the time this morning to talk with us. Have a good day.
Thank you, Deb.
Thank you.